If you are wondering how you're going to manage pain in your upcoming birth, you are in the right place. Today, I'm going to share the 4 ways that you can manage pain in your upcoming hospital birth. And I'm here to give you kind of the pros and cons of each of them so you can start to think about what you would like and how you'll make choices for yourself when you're in labor. But if we haven't met yet, hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am your go-to labor nurse that gives you evidence-based research so that you can make choices confidently in your upcoming birth. If that sounds great, go ahead and give me a follow, and I love it when you guys like these videos. It really helps them get out to more people. Okay, the first one, and it's one that a lot of people don't talk about. I call it the unsung hero of labor and delivery, and it is IV pain medication. Now, every hospital kind of does it differently. The 2 I've seen used most frequently are fentanyl and Stadol, although they both work very similarly. They are meant to take the edge off of the pain so that you can relax. So once we give the medication, the pain's not going to go away. It's just going to take the edge off. A lot of people compare it to like a stiff drink so that you can try and relax and get some rest between contractions. And hopefully when you relax, it helps to open up your cervix and baby can come down. One pro tip about IV pain relief is that every time we give it, it works a little bit less because you become tolerant to it. So the first time we give fentanyl or Stadol, it is 2 thumbs up. You'll love it. Unless some people fight it. Some people really don't like that feeling, and so they end up fighting it. So I always encourage my patients to just relax into it. It does feel a little bit out of control if you've never had IV pain medication before, but the more you can relax into it, the better it's going to work. However, second time, 4 stars. 4 stars for the IV pain medication. And then the third time we go to give it, people are like, when are you going to give it? And I'm like, girl, I already gave it. And they're like, no, you didn't, because you become tolerant to it. So if people are wanting IV pain medication when they're in early labor, 1 to 4 centimeters, it is probably not going to take you all the way to 10 centimeters. And sometimes, this is just me, I sometimes wonder, why are we doing IV pain medication in the beginning if we ultimately want an epidural? I think, why not just go right to the epidural? But it's totally up to you. It's something to consider. One other thing about IV pain medication is that some of it does get to the baby. So the baby gets a little tired and sleepy too, and we don't want that to happen right before delivery. So usually we cut you off from IV pain medication at about 8 centimeters, maybe 9 if it's your first baby, but we really don't want to give it and then baby comes out and is just sleepy. There are things we can give to reverse it, but it's not very fun. So we really try not to give it right before delivery. It takes about an hour to get out of you or baby's system. One of the pro tips about pain relief during labor is that if you are tensed up, your cervix is going to tense up too, and that makes it so baby doesn't come down into the birth canal. So you have to learn to relax into the pain, and I love that we have medical interventions that can help you do that should you need them. Okay, the second thing, which is not available in all places, you're going to want to call your hospital to see if it's available where you are. It's nitrous oxide. So it is given like how you see oxygen given in the movies. They put it on your face. Well, you put it on your face. And it, again, takes the edge off of contractions. Most people compare it very similarly to IV pain medication, but nitrous oxide can be given right up until delivery because it is out of your system so fast. So yes, it is the same nitrous oxide that you are given in the dentist. So just something to be aware of. If you like that feeling when you're at the dentist, maybe you would like that. I hear that most people think that it works in the beginning, but then they ultimately end up wanting an epidural if they really want long-term pain relief. Okay, the third thing is natural pain management. I have a whole bonus video in the online prenatal class for couples that goes over how to manage your pain naturally. And I would totally encourage you that if you're hoping to go natural, you really need to do a video like that gives you tips and ideas. A lot of people come into the hospital just going, oh, I won't need an epidural. I have a high pain tolerance. I don't believe anyone has a high pain tolerance. And then they end up getting disappointed because they weren't able to cope with the pain and get an epidural. I don't think anybody should be disappointed in however they end up making choices in labor, but I'm just putting that out there that if you want to try and avoid an epidural, you really need to take some education into your own hands. Now, let me give you a little bonus. So when I was talking before that if you are clenched up, baby can't descend into the birth canal because you are holding it up there with all your stress about the pain. So one thing you can do, and you've probably seen it done a lot, is labor breathing. And I'd love to go through a little bit of labor breathing with you. So we're going to do it right now. The he's are when we breathe in and the who's or when we breathe out. So you can do any pattern you want. We go and we practice this in the online prenatal class for couples. And I always encourage you guys to practice it with your partner at home. I like to do 3 he's and 1 who. That's just what is most comfortable for me, but you can do 2 he's, 3 who's, whatever you want to do. Just remember you're breathing in on the he's and you're breathing out on the who's. So let's do it together. Again, you're breathing in on the he's and you're breathing out on the who's. Now let's do it one more time, and I want you to notice what's happening downstairs. Yeah, that is totally relaxed, because when you're breathing and your diaphragm's moving, your pelvic floor is just like, cool, you guys have got this. We don't need to engage right now. So that's one of the big benefits of labor breathing and learning to manage your pain naturally so that you aren't stressed by the pain and holding baby up there with all the tension. One thing a lot of people don't realize with natural pain management is that if you start to sort of get out of control, it sends all these stress hormones to both you and to baby. And I've noticed that when baby comes out, when mom is literally just overwhelmed by the pain and maybe freaking out a little bit, baby comes out and just lays in the warmer and doesn't want to move because they feel like they've just run a marathon. So you really don't want to be in an out of control area thinking, I'm just going to make it through this because I don't want to get an epidural. You really want to have some pain management techniques so that you and baby are not overly stressed during labor. Okay, the last one is the epidural. Now, if you guys don't know what an epidural is, it's where we put a needle into your back and we give you some pain medication into that area to help numb you. So you are going to be numb from about your bra line to about your knees is the hope. Now, let me give you 2 pro tips with the epidural. Number 1, everyone thinks it's going to be miserable to get put in, but I think the epidural actually hurts similar to getting an IV put in. So if you've ever had an IV put in, I think it's very similar. And in fact, a lot of people think it hurts less because they're in more pain when they get the epidural put in than when they get the IV put in. So if the pain of the epidural is what's stopping you from getting it, maybe that helps you out. The second thing is that your epidural can be tailored to you. A lot of people are like, I don't want to get an epidural because I don't want to be completely numb and unable to move in the bed or unable to push. So when we do an epidural, it goes into a little pump. It's sort of like an IV pump where it just pulses in epidural medication. And you can say, I would like a little bit more because I'm hurting too much. Or a lot of times there's a little button you can push. Or you can say, this is too much. I want less epidural medication. My personal favorite epidural is a strong epidural in the beginning where you get a nap, because I think a nap totally fuels your tank so that you are able to make it through the rest of labor and pushing. And then when you wake up, maybe we back that epidural off a little bit and you're able to move and do things a little bit more on your own. Again, if you start to feel too much, say, hey, I'd like a little bit more, or a lot of times you can push the button. Or if you're feeling too little, you can say, hey, can we back that off a little bit? A lot of people don't know that. It is a pro tip. A lot of people talk about the walking epidural, but it really ultimately sort of ends up being like that. And most hospitals are not letting you walk with an epidural in. They're maybe letting you stand by the bedside or something like that. Now, let's talk about how you're going to make the choice for what pain management you need during labor. A lot of people come in thinking, I would like to try and avoid the epidural, and I think that is awesome. However, when you get into labor pains, you may find that they're more overwhelming than you had expected. And honestly, what in life is not like that? College was definitely like that for me. Babies were like that. Becoming a labor and delivery nurse was like that. If I could have taken an epidural for becoming a labor and delivery nurse, I 100% would have. The good news is the hospital has things that can help you out if you are in pain in the hospital. So knowing your pain management options and watching videos like this, taking a birth class that goes more in depth into your pain management options is awesome, because you really have to make the choices for the situation that you're in. It's really nice to say, I am not going to get an epidural. I'm going to take a fully natural birth class. But when you get into labor, things change. You might need to be induced or yada, yada. Who knows what goes on? You've got to be educated to make choices with your labor team when labor happens, which is why I recommend a high quality prenatal class. I recommend the online prenatal class for couples. It really is the easy way to get prepared for birth, and people feel so much more confident and happy with their birth when they get prepared. In fact, that class includes interventions like inductions, C-sections, epidurals that a lot of classes sort of gloss over because they are marketing to you thinking you are only going to get a natural birth, and they're not helping you to make choices at the time, because a lot of you are going to be confronted with choices that you didn't expect when you were in labor, and you've got to take a birth class that supports that. Okay, quick reminder, your 4 pain management choices during labor are IV pain medication, nitrous oxide, if your hospital offers it, not all of them do, natural pain management, and an epidural. Now, there are some little things that other hospitals might offer. You can ask your provider if there's anything else, but those are the 4 ones that most hospitals have. If you like this video, please give it a thumbs up and follow me so that I can give you more information for your upcoming birth. And I bet you'll like some of these other videos as well.